Welcome everyone. Today let's study about deltoid muscle under the following headings: its origin, its insertion, its nerve supply and action, its structure, and the structures under cover of deltoid. Okay, and finally its applied importance. First, coming to its origin, the deltoid originates from two bones. You can see this is the clavicle which articulates with the scapula. You can see this is the acromion process of the scapula. So the deltoid originates from two bones, the clavicle and the scapula. From the clavicle, it takes origin from the lateral one-thirds. From the lateral one-thirds on its anterior border of the clavicle. From the lateral one-thirds of the anterior border of the clavicle. You can see here it's taking origin from the lateral one-thirds of the anterior border of clavicle. Next, the acromion process and the spine of the scapula, okay, and the spine of the scapula, which is part of scapula, okay, and from the acromion process and the spine of the scapula, which is part of scapula. Now we can see that this is the dorsal aspect of scapula. This is the acromion process. It's acromion process which is continuous with that of the spine of the scapula, okay, and the spine of the scapula. So the deltoid takes origin from the acromion process and from the crest of the spine of the scapula. So this is the lateral aspect of the acromion process, from the lateral aspect of the acromion process and from the lower lip of the crest of the spine of the scapula. You can see it's the lower lip of the crest of the spine of the scapula. Coming to its insertion, this is the humerus. This is the anterior aspect of the humerus. Here we have a roughened portion here. This is the deltoid tuberosity. So the deltoid inserts into the deltoid tuberosity of humerus. That we can see it here. As we see, the deltoid is inserted into the deltoid tuberosity of humerus. Okay, gets inserted into the deltoid tuberosity of humerus. Next, coming to its nerve supply, the nerve supply to this deltoid is by this nerve, which is the axillary nerve, which will enter here through the quadrangular space. Here will be the quadrangular space. It will enter the axilla through the quadrangular space and it supplies the deltoid muscle, okay, and it is related to the surgical neck of the humerus. So in surgical neck of humerus fracture, this nerve supplying the deltoid, that is the axillary nerve, can get damaged. Next, coming to the structure of deltoid. To study the structure of deltoid, we can study under three parts. You can see these are the anterior fibers, these are the middle fibers, and these are the posterior fibers. You can see the anterior fibers originate from the clavicle, the middle fibers take origin from the acromion process, and the posterior fibers take origin from the lower aspect of the crest of the spine of the scapula, lower aspect of the lower border of the crest of the spine of the scapula. Now the middle part that is taking origin from the acromion process is an example for multipinnate muscle, okay. The middle part which take origin from the acromion process is an example for multipinnate muscle. This multipinnate arrangement helps in packing of tightly packed fibers, okay, tightly packed large volume of muscle fibers in a small area. So that determines the strength of the muscle. So the multipinnate arrangement will be, the muscle will be stronger when compared to the same volume of a unipinnate or a bipinnate muscle, okay. So the muscle strength is directly proportionate to the number of muscle fibers arranged in a area rather than the length of the muscle fiber, okay. This multipinnate arrangement is seen in such a way that there are four septae of origin, okay. These are the four septae of origin which are coming from the acromion process, and there are three septae of insertion which will be getting attached to the deltoid tuberosity, okay. So we can see the arrangement, multipinnate arrangement of muscle fibers between these septae of origin and septae of insertion. Next, coming to the action of the muscle. You see, the action can be studied again by looking into the three groups of muscle fiber, that is anterior, lateral and the posterior group of muscle fiber. Okay, this anterior fibers will help in flexion at the shoulder joint, and also, so the flexion will be like this from here, the axis of movement is like this. Okay, the flexion of the shoulder joint, and also it will be helping in the medial rotation. So there will be medial rotation. Okay, also it helps in medial rotation at the shoulder joint. Okay, next, the acromion fibers. So these acromion fibers are mainly responsible for abduction at the shoulder joint. It will be responsible for abduction at the, so the movement will be like this, the abduction at the shoulder joint. So the abduction will be from 15 to 90 degree. From 15 to 90 degree abduction is by the acromion fibers. Next, last, the posterior fibers. Okay, these posterior fibers will be helpful in the extension at the shoulder joint. Okay, extension at the shoulder joint, and also the lateral rotation at the shoulder joint, Next, let's study the structures which are present deep to the deltoid. Okay, structures which are present deep to the deltoid. Now let's remove the deltoid so that we can study the structure undercover. Now the deltoid is removed, so we can expose all the structures which are undercover of deltoid. First, you can see along the greater tubercle, you can see the insertion of three muscles, SIT, supraspinatus, infraspinatus and teres minor. And along the lesser tubercle, we can see the insertion of the subscapularis, which will be coming from here, which will take part in the formation of rotator cuff. Okay, the subscapularis. Okay, then we can see the insertion of, now we are covering only the insertion, we can see the insertion of these three muscles which are related to the bicipital groove. You can see along the lateral aspect the pectoralis major, this is the teres major, and in between these two we have latissimus dorsi. You can remember it as lady between two majors. Okay, lady for latissimus dorsi, which will be in the bicipital groove, and along the lateral lip we have the pectoralis major, and along the medial lip we have the teres major. Okay, teres major. So this is about the insertion in the humerus. Next, we can see one insertion in the coracoid process of scapula. You can see at the coracoid process of scapula, we can see the insertion of pectoralis minor. Okay, we can see the insertion of pectoralis minor. So these are all the insertions we can see under cover of deltoid muscle. Then we can see the origin of some of the muscle. From the coracoid process, we can see the origin of coracobrachialis and the short head of biceps. Okay, and the short head of biceps. Along the infraglenoid tubercle. Okay, infraglenoid tubercle. So this is the scapula and this is the infraglenoid tubercle. Along the infraglenoid tubercle, we have the origin of the long head of triceps. Okay, the long head of triceps. Then along the supraglenoid tubercle here. Okay, along the supraglenoid tubercle, you can see that red structure there. That will be the origin of long head of biceps. Origin of long head of biceps. At last, in the humerus, along the spiral groove, just lateral to the spiral groove, in the middle part of the shaft, we can see the origin of the lateral head of the triceps. You can see the origin of lateral head of triceps. Next, we can see some nerves and vessels related to the neck of the humerus. That is the axillary nerve and the anterior and posterior circumflex humeral vessels. Next, let's see the joints which are present beneath the deltoid. The shoulder joint and the acromioclavicular joint. Okay, shoulder joint and the acromioclavicular joints. So if you see the bones which are related, it is mainly the upper end of the humerus and the coracoid process. Okay, the upper end of the humerus and the coracoid process of scapula. So if you see some of the ligaments which are related, that is the coracoacromial ligament. Okay, the coracoacromial ligament, the glenohumeral ligament. Okay, these two ligaments are related deep to the deltoid. The musculotendinous cuff of the shoulder, okay, that is the rotator cuff of the shoulder, is also related deep to the deltoid along with the capsule of the shoulder joint. Okay, at last, if you see the bursas around the shoulder, all the bursas around the shoulder are related deep to the deltoid muscle, like the subacromial and subdeltoid bursae. Okay. At last, coming to its applied importance, intramuscular injections can be given in the deltoid muscle. The site of intramuscular injection should be, so first we have to palpate the acromion process, 2 finger breadth. Okay, you can just place 2 finger below the acromion process, just below the acromion process, in the triangular area below the 2 finger breadth. Okay, in the triangular area below the 2 finger breadth, we can safely give intramuscular injection at the deltoid. So this will avoid injury to the axillary nerve and the anterior and the posterior circumflex humeral vessels. Okay, this is the position of intramuscular injection. Similarly, intramuscular injection in the lower limb can be given in the gluteal region, at the upper outer quadrant of the gluteal region. Next, in case of injury to the axillary nerve, the deltoid gets paralyzed. Okay, if the deltoid is paralyzed, the rounded contour of the shoulder will be lost. There will be wasting of the muscle, so that the rounded contour of the shoulder will be lost. One. Second, the abduction from 15 to 90 degree will be impaired, or it will be lost. Okay, the abduction at the shoulder joint from 15 to 90 degree will be lost in case of axillary nerve injury for paralysis of deltoid muscle. These are the applied importance related to deltoid muscle. Thank you.